Hey family, Shana Singleton here. And if you test positive for HSV1 or HSV2, you are a cousin. So, hey, cousin. Today we are going to be talking about the relationship between herpes and an unpleasant odor. Welcome back to my channel. For people who are new to my channel, my name is Shana Singleton, also known as the Herpes Goddess and founder of Slay the Stigma, where I help women stop their outbreaks and get laid. I have a whole coaching program. I have tons of testimonials. That is truly my magic. If you want to check out some of my testimonials, go to my Instagram page at Shana Singleton. Now, I'm also the founder of Hey Cousins. I have been extensively researching this virus for the past 7 years now, and I have been a coach doing the field work and interviewing and coaching people who test positive for herpes for the past 4 years now. I'm a member of the National Coalition of Sex Health, author of several different books, responsible for growing the largest herpes awareness platform, and just kind of, the expert. Now that you know a little bit about me, I've almost been living with this virus, both types, on my genitals for almost a decade now. And I've been able to stop my outbreaks. And again, that's what I teach other women how to do. For more information about my coaching program, go to the description box below. If you're searching for herpes resources, go to the description box below. If you are interested in any of my books, go to the research description box below. Support is free and your girl needs it. So make sure you subscribe to my channel. Pretty please, with a cherry on top. Like, share, don't be afraid. I need your support so I can continue spreading the word. Thank you and welcome. Now, enough about me. Let's get into it. The relationship between herpes and an unpleasant odor. In general, herpes itself does not typically cause a noticeable odor. However, it is essential to understand that the herpes simplex virus, HSV, can sometimes lead to secondary infections, such as a bacterial infection, which may result in an odor. A lot of women experience that within the community. I'm not someone who experiences an odor, but our cousins in the community who experience outbreak inside of their vaginal canal has a tendency of getting back-to-back BV. These infections can occur when the blisters or sores associated with a herpes outbreak become irritated, inflamed, or develop a bacterial overgrowth. If you happen to notice an unusual smell alongside your herpes outbreak, it is recommended to seek advice from a healthcare professional. They can assist your symptoms and provide an accurate diagnosis and appropriate treatment if needed. It is important to remember that various factors can contribute to changes in vaginal odor. Some bacterial infections that can cause vaginal odor and may be associated with herpes outbreaks include, number one, bacterial vaginosis, aka BV. BV is a common vaginal infection characterized by an overgrowth of harmful bacteria in the vagina. When herpes does not directly cause BV, the disruption in the vaginal pH balance during a herpes outbreak can increase the risk of developing BV, which can lead to a fishy odor. Number two, urinary tract infections, UTIs. Although UTIs are primarily caused by bacteria entering the urethra, herpes outbreaks can create an environment that promotes bacterial growth, increasing the likelihood of developing a UTI. UTIs can cause urinary odor, and if left untreated, they can potentially lead to a vaginal odor as well. It is important to note that vaginal odor can have various causes, and not all instances are directly related to herpes or bacterial infections. If you are experiencing persistent or concurring vaginal or odor, it is recommended to consult a healthcare professional for an accurate diagnosis and appropriate treatment. They can evaluate your symptoms and provide personal guidance to address your situation. Now, let's just talk about preventing BV, right? We all want to know guidelines for vaginal health and dietary considerations. Bacterial vaginosis, aka BV, is a common vaginal infection caused by an overgrowth of certain bacteria, leading to symptoms like abnormal discharge, fishy odor, especially after intercourse, itching and irritation. BV occurs when the natural balance of the vaginal bacteria is disrupted. To help prevent BV, consider the following guidelines. Here are 6 tips, right? Tip 1, maintaining good hygiene. Use mild, unscented soap and water to gently clean the external genital area. You never want to go inside of your vagina and clean it with soap. Avoid harsh soaps, douching, scented products that can disrupt the natural bacterial balance. My go-to soap for that, as well as herpes, is a bar called the Peppermint Yoni Smoothie Bar by Smoothie Skincare. I'm going to put the link somewhere on this video. It's here right now, the link. That is the best soap on the market for herpes, the best soap on the market for pH balance, and they don't even promote it for that, okay? Number 2, avoid douching. Douching, I think I'm saying that right. Douching disrupts the vaginal flora and increases the risk of BV. Allow the vagina to clean itself naturally. Yes, your vagina naturally cleans itself. Number 3, minimize vaginal irritants. Reduce the use of scented tampons, scented pads, and vaginal sprays, which can irritate the vagina and disrupt the natural balance. Number 4, practice safe sex. Use condoms during sexual activity to lower the risk of sexually transmitted infections that can contribute to BV. While BV is not categorized as an STI, sexual activity can disrupt vaginal flora and increase the likelihood of BV. Our vaginas are acidic. Male semen is alkaline. That's definitely a reason why you can experience BV after intercourse. Tip number 5, limit multiple sex partners. Having multiple sexual partners raises the risk of bacterial imbalance and infections, including BV. Maintain a monogamous sexual relationship or consistently use protection to reduce this risk. Tip 6, avoid unnecessary antibiotic use. Excessive or unnecessary use of antibiotics can disrupt the natural balance of the vaginal bacteria. Only use antibiotics when prescribed by a healthcare professional and follow the recommended treatment course, all right? While a healthy diet supports overall well-being, there's certain foods alone do not have strong evidence to prevent BV. BV primarily results from bacterial imbalances rather than dietary factors. However, maintaining a balance and nutritious diet can indirectly support your immune system, potentially reducing the risk of certain infections, including BV. Consider the following dietary practices for vaginal health. Tip 1, probiotics. Foods rich in probiotics like yogurt with live cultures, sauerkraut, kimchi may have potential benefits for vaginal health. Probiotic supplements formulated for vaginal health are also available. Consult a healthcare professional for the best options. Antioxidant-rich foods, that's tip 2. Include fruits and vegetables in your diet to obtain antioxidants that support immune functions. Aim for a colorful assortment, including berries, leafy greens, citrus fruits, coniferous vegetables, like broccoli and cauliflower. Tip 3, hydration. Stay hydrated to maintain optimal bodily functions, including vaginal health. Drink an adequate amount of water throughout the day. Remember, these dietary practices should complement proper hygiene and any prescribed medical treatments. If you think you're having BV or experiencing symptoms that won't go away, consult a healthcare professional for an accurate diagnosis and appropriate treatment options to restore the vaginal bacterial balance. Again, you guys, I'm Shana Singleton, Coach Shana Singleton, founder of Slay the Stigma, where I help women minimize and stop their outbreaks. It really depends on them, and break free from shame so that they can get laid. If you're interested in working with me, if you're interested in my coaching program, go to www.coachshanasingleton.com. Every Monday, I'll be dropping a herpes tip. Every Wednesday, I'll be teaching you about the virus. And every Friday, we will be dismantling the stigma. That's Slay the Stigma Fridays. So make sure you subscribe so you don't miss out on any of the upcoming videos. Thank you for being here. I love you. Have a good day.